Without doubt, the most important skill you can have as a dentist or a doctor is the ability to communicate well with patients. It's one that dentists really struggle with. They sort of want to do good dentistry for their patients, but unless they can explain what they need to do very well, the patients don't understand the need for treatment and they can't sort of see why the treatment's necessary. So, I mean, I've been in practices where there've been highly skilled dentists, very, very technically skilled, but because they're poor at explaining treatment to patients, they only get to do a very small number of advanced treatments like crowns or bridges or veneers. And yet I've seen dentists who don't have anywhere near that level of skill, but because they're very good at explaining treatment to patients, the patients appreciate the need for it and they're constantly doing crowns and things. So it makes a huge difference to the quality of treatment, the type of treatment, and also the financial success of the practice as to how well you communicate with patients. No, I don't think so. I mean, I've seen dentists who are absolutely superb clinically. They really know their stuff backwards and forwards, and yet they have a practice where they financially struggle year after year. And really the only reason is that they can't explain to patients about the treatment they need. And equally, I've seen dentists who really are fairly marginal clinically, but have wonderful practices, highly financially successful, just because they're very good at getting the message across to patients. So I'd say from a financial point of view, the most valuable skill you can possibly have is being able to communicate well with patients. Well, I've been into quite a few practices that are owned by master communicators, and there's a few things I notice. First off, the practice seems very serene, very quiet. The second thing I notice is how happy the patients are, because they're understanding their treatment. They're really understanding what's going on. But the third thing is you just notice that almost all the patients book in for significant treatment. The patient presents at the practice. The doctor has a brief conversation with them, explains what they need, the patient understands the need for treatment, and then the patient books in to have financially significant treatment. And that's the big difference between good communicators and poor communicators. Poor communicators struggle to get patients to book in for significant treatment, whereas master communicators really can just present it in a way that the patient immediately understands and accepts. There are basically two traits for the dentist who has trouble communicating. The first is that they take absolute ages discussing things with patients. I mean, they might take 20, 30, 40 minutes explaining quite simple treatment that a master communicator could explain in 2 or 3 minutes or even 90 seconds. So treatment consultations take a long, long time, and as a result, you'll often see dentists who are unskilled at communicating running late. The second thing is you look at their mix of services, and that is the type of treatments they're doing. So a master communicator will be doing a lot of high-end treatments, a lot of crowns, veneers, indirect dental work. So per month, a good communicator might do 50 crowns a month, may even do as many as 100 if they're really expert at explaining treatment. When you look at a practice run by a poor communicator, you find that they're doing a lot of low-end treatment. So they're really struggling to explain things. So patients who could have a tooth saved, having teeth pulled out, and then instead of having crowns, which restore a tooth permanently, they're having fillings and patch-up jobs. So it's that sort of quality of the treatment they're doing that really differentiates the poor communicator from the master communicator. Poor communicators often think that they're master communicators because they do two things. First off, they very seldom ask the patient for a decision. And what that means is they just sort of present all this information to patients and maybe give them pamphlets and printed quotes and spend ages trying to explain things to patients. And yet at the end of all that, they don't ask for a decision. So the patient is sent out the door to deliberately think it over. Now, the problem with sending someone out the door to think it over is that usually if they have to think it over, you've confused them. You've explained things in such an unclear fashion that they haven't understood. So you've actually confused the issue, and really they're going out the door with a whole lot of information, but the odds of them ever coming back and getting the treatment done are very small. The second thing with a poor communicator is that they tend to underdiagnose. Now, what I mean by that is, let's say a patient comes in and they might need a full mouth rehabilitation. That means they need their whole mouth restored, all their teeth. Now, a master communicator will just diagnose what's there and look at the situation, explain it to the patient, and quite often get acceptance. Whereas a poor communicator knows from past experience and knows from their handling of patients that they have a very little chance of success if they diagnose what the patient needs. So instead what they do is they underdiagnose. So maybe if a patient needs a crown, they might just say, oh, well, we can just fill it, we can patch it up, it'll be fine. Or the patient might need a set of veneers on the front teeth, whereas the poor communicator will say, oh, we'll just patch those fillings up, they'll look all right. And so what they're doing is, by underdiagnosing, they're underpresenting, undertreating the patient, and that's the other characteristic really of poor communicators. The interesting thing is, you can have an outstanding practice without being a natural communicator. Early in my career, I really struggled with communication. I mean, I was an introvert. I used to have this painfully long case presentation where I'd spend ages discussing treatment with people, trying to explain it to them, only to time and time again be disappointed by them saying, oh, I'll go home and think it over, or no way I'm having that treatment. So I know what it's like to be a poor communicator. The only way I learned to become a good communicator was because I could see it was necessary, and then I was prepared to travel and take courses. So I found good mentors and good teachers over the years. So I used to sit in courses and listen to these master communicators and basically learn the words and say the words. One of my biggest faults, for instance, as a communicator, was I had huge trouble saying the fee. Now, patients judge whether your fee is fair by your body language. So if when you say the fee, you're all uncomfortable and tense, like years ago my fee for a crown used to be $600. And I'd say to a patient, you need a crown, and they'd say, how much is that crown that I need? And I'd say, it's $490, like that. And they would read my body language and read my discomfort and think that I was overcharging them. And it took me years to finally be able to look straight in the eye and say, the type of crown that you need there is $600, looking them straight in the eye as I said it. So all these techniques that go around communication, they can all be learned, they can all be studied. Doesn't matter how bad you are now. The thing is the desire to do it, the realisation that you need to do it, and then to find a good teacher. That's really the key.